In today's Health Watch, a concerning, and I mean concerning, new study about men and cancer in the decades ahead. The study estimates by 2050, cancer cases among men worldwide will increase by 84%, and cancer deaths will increase by 93%. CBS News chief medical correspondent Dr. Jon LaPook joins us now on what's behind this and how to protect yourself. And I got to be honest, that is the most terrifying intro I've ever read live on TV. I'm concerned. I truly am.
So, without being, too calming, I would just say a lot of that increase is because of the increase in population that's expected from between here and
that makes sense.
So, there's about 8 billion people, a little more in the United States. In the world now, it's going to be about 10 billion. All right, so just by the fact that there are more people, aging population, there are going to be more deaths. In terms of calculating the risk, like what are the odds of you getting it, it's trickier. They try to project based on things that they have now, statistics and the environment and all that and trends, but it's tougher.
So why did this report focus only on men?
Well, it turns out a 2020 study showed that around the world, the death rate from cancer in men is about 43% higher than in women. Why?
What gives?
Right, they're trying to figure that out, but, there's certain risk factors. For one thing, men around the world, tobacco, by far the biggest risk factor. About a third of men around the world smoke. In the United States, it's about 13% versus 10%, but around the world, it's about 30% versus 6.5%, and then alcohol and some other risk factors.
So those are some of the reasons why higher rates for certain cancers are higher among men.
Yeah, risk factors, and then again, there are things that we're still learning.
Okay, so we're talking by 2050, that's approximately 26 years from now, that there's going to be a almost double amount of deaths. Yeah,
there'll probably be an extra, if you do the extrapolation, about 5 million deaths per year in men, more than now.
What are the most common cancers?
Well, the most common cancers in both men and women are lung cancer first, and then in men you have prostate cancer, colon cancer. In women it's lung and then breast and colon cancer. You combine them and then colon cancer gets up to number 2 in terms of cancer deaths.
Yeah, you constantly talk about how important it is to get your prostate exam.
And colonoscopy and skin exam and all that.
So what are some ways that men can reduce these cancer risks? This is the million-dollar question.
So billion-dollar, trillion-dollar question.
You're right.
For obviously, tobacco for sure. That's the biggest risk factor. It accounts for 30% of the cancer deaths in the United States and 20% of the cases, And after that, we've talked about this before, trying to have a healthy diet and a healthy weight and exercise and don't have too much alcohol, all these things that can be really tough to do.
Processed foods.
Right, lean towards plants, legumes. But I want to make a point here that I have not made before that I was thinking about. We're threading the needle between, empowering people. We want to know there are things you can do.
Right.
In terms of 40% of the cancers are related to lifestyle, things you can do.
Yeah.
But that means a lot are related to things that you can't do. We want you to do all the screening type tests. I don't want people to feel guilty. There are more than about 2 million people a year in 2024 are predicted to have cancer.
Yeah.
Okay, we're not done with the year yet. So I don't want people out there who have cancer to say, oh, it was something I did.
Right,
I think that's really important.
But you can create some discipline in your life and reduce those rates. Thank you, Dr. Jon LaPook. We appreciate you.